Okay, well, hello everybody, and welcome to today's webinar, What's in a Supplement, hosted by Drug Free Sport. We've got a great presentation set up for you today. We want to kind of go over a few things to help you get started, and I'm actually going to launch a poll while we have people still logging in. So I'm going to launch this. You should be able to see it, so go ahead and take a moment and respond to our first poll question. You should see that launched. So as you're logging in and we're getting going in, so it's just, what's your primary role within your sport organization? And I realize I don't have all of the choices listed there, but we're going to use poll questions throughout the presentation to kind of keep this activated, and then also use our webcams so you can see me as I talk. I'll try and make as much eye contact as possible, as this is new. It's a little bit of fun. So we've got about 70% of you voted. I'm going to close this just to kind of get a look at what we have. And we can kind of see the results there. We've got predominantly about 33% of you are athletic trainers, almost 40% dietitians, which is great, some team coaches, strength and conditioning personnel, administrators, and other sports medicine staff. And go ahead, you can use the chat box to communicate with me if you didn't feel like your role fit any of those descriptions. I'd be happy to give you a little shout out there as well. But I do want to go ahead and I'm going to turn off my webcam just so we can see my screen. And other things that, oops, I don't want to pause that. I want to show that. So just a little housekeeping as we get going. This is a screenshot of what your attendee view will look like. You can join with either your mic and speakers or join by telephone. It's completely up to you. Please also utilize this questions box throughout the presentation. I will be monitoring these along with my colleague, Anna Filardo, answer as many as we can, and then also hold those for the end of the presentation as well. And this little arrow kind of helps you open it as you go in. Just a reminder that today's webinar will be recorded as well, so you should receive that in your follow-up email within 48 hours. Other things to note, it is required by the Board of Certification for Athletic Trainers that you're actively present in today's live event, and then also complete the post-webinar survey to receive your continuing education certificate. Both the PDFs of the slides and the CEU certificates, if that is applicable to you, will be emailed to attendees within 48 hours as well. And any other questions, you can see my email there, and I'm happy to answer those after the event as well. These are our learning objectives. They have been posted kind of all over before, so I'll save us the measure of reading them for everybody and get straight to our content. And with that, I'd like to make sure that we turn it over to our speakers. I'm not going to read their full bios. You'll notice this little handouts box again on your control panel, and you're able to download a few resources that we've uploaded for you, as well as the full speaker bios. And so what we want to do is take a moment and introduce our speakers as well. And so today we have John Travis, Senior Research Scientist with NSF International Dietary Supplement Programs, and he is going to join us via webcam here as well. Brian Jordan is the Technical Manager for NSF International Certified for Sport Program, and he will also be joining us via webcam. But I'm going to go ahead and turn it over to John in just a moment. So there's Brian, he's just popped up here, and I know John will be joining us here shortly as I transition him to presenter. And there we go, John. Go ahead and take it away.
Great, thanks, Lara. Hello, folks. Let me adjust my screen here. I put up my ugly mug in front of my slideshow so I couldn't see it. So hope you're having a good day today. We're going to talk about dietary supplements, specifically what's in a supplement. A little bit about NSF International for those who don't know. For those who do, just bear with me. So we are a public health company. That's our mission. We're focused on protecting and improving human health. Been in business since 1944, and we do work in areas of food quality, water quality, and basically anything that has to do with people. So how we help improve human health is we write quality standards for drinking water, food, anything of that nature. We test products to those standards. For instance, and which germane to this discussion today is dietary supplements, but we also test water filters, plumbing components, and things of that nature. We certify the products that they meet these standards. We audit manufacturers, retailers, distribution places for their quality standards, making sure they're maintaining good quality within their facilities. We consult with those folks on a contract basis to help them improve their quality, and we provide training as well. So just a quick question here. This is a sneak ahead. Laura, if you can put up the first polling question, please. So I don't know how to see that view. Let me see if I can get it up here for me.
Oh, John, I got it. I'm sorry. I'm just waiting for, we've got 63% of live attendees voted, so we're going to give it a couple seconds here just for them to close
I don't even see the poll.
Yeah, so we're going to close it in just 2 seconds, and we've got those results for you. And we do have a question or a comment from our attendees so that you might be able to respond to this, John, in your presentation, but they're just, Kat is suggesting there should be an option for loosely regulated, potentially.
Yes, I know, but I was trying to just gauge people, even loosely regulated, and that's probably a better term for how it is, but we'll discuss that in a moment. So the preponderance, an overwhelming majority is no. Now, it was a little unfair of me to throw this slide up for you to see before the polling question came out.
Oh, John, sorry, just a second. I think you got muted somehow.
Yes, I need to be careful with that button. Oops, sorry, folks. So this is just the popular media and how they portray the supplement industry. All headlines, Consumer Reports. This one really, I mean, sensationalized headlines. American, you can see these. When in truth is the FDA does regulate dietary supplements. In '94, Congress passed the Dietary Supplement Health and Education Act, affectionately known as DSHEA, where they regulate dietary supplements as foods. So within how DSHEA does that is, first it defines what a dietary supplement is. A and B, you can read them. Everyone pretty much has a good understanding of those. What I think few people know are C and D, where they discuss that if something was developed as a dietary supplement, but they discover that it has drug-like properties and somebody submits it as a new drug application to the FDA, it still is considered a dietary supplement. Substances such as vinpocetine, huperzine A, those were marketed as dietary supplements prior to them having a new drug application filed with the FDA. DSHEA goes on to talk about what an adulterated supplement is. So if you can read what it says there. Cases that are examples of these are a few years back, you remember Oxylate Pro and all of the deaths and liver problems that were caused by a certain population of folks that lived in Hawaii. That's FDA removed that from the marketplace using this particular regulation. And again, here are some more of the regulations. These are the bullet points, and just reading the regulations is rather dry and tedious, and it really can be difficult to pick out what the germane details are, but I've done that for you here. So this will be great for you for future reference. So with this, the other important thing that DeShay did is it defines what a supplement is, defines what is adulterated supplement, defines, in this case, what is a new dietary ingredient. Now, the supplement industry, while it is, people use the term loosely regulated, it's really, these regulations are pretty comprehensive. Enforcement of them, that's another question, but we can talk about that in a little bit here. So what they're talking about with new dietary ingredients is, as you know, you're always seeing these new products come out. It's like, well, this ingredient, this ingredient will give you more energy. This will increase your or reduce your aromatization of testosterone, increase your testosterone, make you look like Arnold Schwarzenegger. All those things are in there, and it's both a boon and a bane for the industry to have this kind of regulation, and that allows for a lot of innovation, but it also allows for a lot of adulteration and shady characters to enter the marketplace. And finally, the good manufacturing practices, which is the keystone for all that we do here at NSF within our dietary supplement certification program. So this is why GMPs are important. We have auditors in China that inspect facilities, and this is an example here of a good facility. You can see that looks pretty clean, nice shiny extraction drums back there. They're pretty large. Looks pretty clean. They have some air controls up there. This is another one we inspected. It's kind of shocking, isn't it? The dichotomy between the two. Hence, that's the importance of GMPs. Now, Laura, can you introduce our second polling question, please?
You bet. So here, what is your primary source of information regarding dietary supplements? And we've got a number of questions, so I know that you might use more than one here, but your primary source again, and go ahead and submit that information. We've got about 20% of you that have responded, so we'll keep this open for trying to get your votes in the next 5 seconds here. We'll close that up.
And be honest, there's no wrong answer here. Everyone has their sources, and this is just to help you find sources that will provide you with the proper information that you need.
Absolutely. Okay, so here are our results. And it looks like we've got 43% independent health organizations / drug-free sport access. Peer-reviewed journals comes in at 23%, and then almost 20% specific product websites. FDA about 14%.
Fantastic. So I noticed a few of you said product websites. What would you folks think about this website here? This is a website out of the UK. It's run by an organization company called Predator Nutrition. They have a product here called Blackstone Labs Eradicate. Now we're going to discuss kind of how I view labels and with a cynical and clinical eye. So you notice on that label, this is automatically to me a suspicious product when I see something that says post-psychotherapy. And I'm sure it is to many of you folks out there as well. So supplements that usually market themselves or position themselves in the industry with this kind of naming and this kind of sales pitch, they are looking to take advantage of folks who would consider themselves steroid users, just to be blunt with that. So there's probably a segment of the dietary supplement users that actually go out and look for products that have steroids and things in them. A post-psychotherapy supplement, as you probably all know, is designed to, when you stop taking steroids, to stimulate your body to produce testosterone again. Now this particular one, Blackstone Labs Eradicate, it fits all those pushes all those buttons. Look at the label. Does anyone see anything that would be of concern to them in there? I don't know if we have that raise hands feature or not, but I know to me the ingredient there that sticks out like a sore thumb is aromatase. Aromatase is an aromatase inhibitor, so it's not really how they are marketing the product as opposed to psychotherapy. In actuality, it's designed to prevent aromatization of testosterone to estrogen within the male body. It prevents the female characteristics, obviously, from appearing that for men who are taking steroids. So this is one substance here. I believe in 2015 there were 3 adverse analytical findings reported within the WADA community of labs for this substance itself. So that's just one thing. That's another problem ingredient over time, and this one's probably much more well documented, is DMAA. Now, this is old news kind of, but I think it helps us understand what's going on in the supplement industry and how everything comes to be. So, and back in the 40s, Eli Lilly was experimenting with these aliphatic type amines, which just means hydrocarbon chains with an amine on them as nasal decongestants for sympathomimetic. So that means that it mimics the sympathetic, or it stimulates the sympathetic nerve system like epinephrine and norepinephrine do. Now, Patrick Arnold, very smart guy, but he does not always operate on the good side of the law. He knows the regulations very well. He worked for a company, and actually he opened a company called ErgoPharm. So he had been combing the scientific literature. Part of this is conjecture on my part, just based upon what was being stated on his blog and what was on bodybuilding.com at the time. So he found this Chinese publication that claimed to have found the substance DMAA in the oil of geraniums. So he had his documentation that it was a dietary ingredient because geraniums were used in commerce at the time as a dietary ingredient. So hey, I met the first quality, so I don't have to have an NDI. People have been using it for a long time, so the safety is assumed. So I'm gonna use this as a dietary ingredient. So with this, he made this product called, I forget the exact name of the product, but he called the ingredient AMP. It's just another synonym for DMAA. So you can see here back in 2006, somebody got wind of it and was able to and posted this post on bodybuilding.com. Same time frame. This is maybe a month later. If you go, you could or this was actually a year prior. You can look where he was soliciting for the purchases of this ingredient. It was a synthetic hydrochloride salt of this 4-methyl-2-hexanamine, otherwise known as DMAA. So it wasn't even likely being extracted from geraniums. And in fact, some of the work we had done here and some of the work that other colleagues of mine had done, we debunked that as assertion that is present in geraniums ever, and it's never been found since. So a little bit more of the history. After all, so you notice the first slide was 2005, when it took 7 years before the FDA was able to do anything about it. But then within a year and a half, they moved pretty rapidly to remove from the marketplace. Or so we thought. This slide here represents products that I looked up on the internet and was still able to purchase within the last week. If you notice, the one on the left, the Hydroxy Elite from High-Tech Pharmaceuticals, they were ones on the previous slide, the last bullet point discussed in November 2013, that FDA rated High-Tech Pharmaceutical and seized all of their DMAA raw ingredients and all of their products. Well, lo and behold, what happened to this gentleman who owns that company took his manufacturing to Mexico. So now FDA really has limited jurisdiction to be able to seize product at a manufacturing facility since it's in Mexico. So he continues what he's doing. And the one on the right, same thing. This one has an insidious mixture of DMAA and some phenethylamines. And we'll talk about phenethylamines in a moment. Lara, how about let's do the third polling question, please.
No problem. How often do you or your athletes use supplements? Select monthly, weekly, daily, never, or don't know. And if it's more than daily, you can, or more than once daily, I would select the daily feature. So go ahead and plug those in. How often do you or your athletes use supplements? All right, I'm going to go ahead and close that. Looks like the majority of you have responded. And these are our results. So an overwhelming majority say daily, 71%, 20% don't know, and then a scattering for the others.
Well, that's very good. I myself use supplements on a daily basis. Multivitamin, fish oil, vitamin D, and sublingual vitamin B12. So nothing extremely out there like what's shown on this product here. This is a product that I had done some testing on, and the previous slide we were talking about stimulants, all the phenethylamines. Well, here's an example of a product that has some phenethylamines on there. Now, both of these would be considered under the prohibited substances under the new WADA code as phenethylamines and derivatives. So I was doing some work and run across this product, so I decided to test it. So I was looking, and the structures of those two substances on the left, if you notice the similarity in structure to, and I'll point it out, to amphetamine. So I tested this product, and what I should see on the bottom circled, I should see something of the same number as the 136, but yeah, I see a number 150 and a little peak up there. It's a little scientific analytical chemistry stuff, a little lesson for you today. I forgot to put that under CEU, but here it is. So there's no evidence of these two substances being in here. There's this other substance, unknown substance. Now, to me, I kind of have an idea when I look at that. I was really excited thinking, wow, this is the mass signature for methamphetamine. Now, I did this work after we had done a study about the supplement craze, and I was kind of excited. It's like, wow, could this actually be happening twice where somebody has either methamphetamine or a methamphetamine analog in a supplement? So I did some more work. There's the structure of the methamphetamine on the right. Lucky for the industry, maybe a little lucky for me in our publications that we do, it was a substance known as phenadrine. It didn't match up with methamphetamine. There was a slight difference in the detection signature. So, but still, this substance is on the WADA prohibited list. It would have some benefit to the athlete to take, and based upon that label, the athlete would not know they were consuming this product and potentially could test positive in a drug test and be barred from competition. So these are some of the dangers of the supplement thing, because there's some manufacturers that are not doing due diligence and are not making quality products out there. Another one, Blackstone Labs. You'll notice this theme of mine with Blackstone Labs. They're currently one of my favorite companies, and I say that with a bit of sarcasm. They're a company that has many, many dodgy products. This particular product here, Dust V2, they had a Dust V1 that had, I believe it was the dendrobium extract that was the same, similar to what was in Craze, the product where it was a methamphetamine analog. So they came up with this V2 thing. One thing that kind of got me excited about that is, if you look down, even though it's spelled wrong in the label, they have this ingredient called arcyl fuel, and they're calling it acrylamine hydrobromide. Well, it's actually ericoline. Ericoline is, if you look at that structure there, it's very similar to nicotine. So it has some kind of stimulant effects, but it also is genotoxic and carcinogenic as well. the indigenous populations that chew this nut, this areca nut. It's also known as a betel nut. They chew it just like people would chew tobacco, and it causes lots of a high preponderance of mouth cancer and esophageal cancer within the populations that use it. So I was excited when I saw it. It's like, well, maybe, and additionally, FDA has an import ban in the U.S., so people that cannot import this product reportedly into the USA. So we ordered that product, and thinking we were going to get one thing, and then we got a product, well, it has the somewhat same label on it, has different ingredient lists. I haven't completed testing on this yet. I'm still looking at all of these stuff that's in there, but it has this Cymbidium garengii, I believe is the correct way to pronounce it. It's an orchid. So I'm thinking, hey, maybe it's similar again to the crasing. Maybe that's coming back and they're sticking another stimulant in it. So we've done some preliminary work. This is some of that portrayed here from an analytical chemistry point of view. So many of the ingredients on the label we're able to verify that are in there, from L-carnitine to caffeine to N-acetyltyrosine. But also we've done a little bit deeper digging, and this is a compound that's in it as well, but it was not disclosed on the label. L-dopa is a Parkinson's disease drug. It's not known to be present in any of those ingredients, so obviously this product is adulterated and it's not disclosed on the label. While it may not be an anti-doping offense, it definitely is a health risk for people unknowingly take this, because I don't believe this drug has been tested on normally healthy people. So it's unknown how the chronic effects of daily dosage would affect a healthy individual. Also in this product is another substance here called alpha-muramic acid. Yeah, I just cursorily started looking into this particular ingredient, or this particular substance, sorry, and it's really an indicator of bacterial infection. So we're looking for other indications within this product if it's been compromised. Another product, and this is all research I'm doing right now, and this is all current and has not been published yet, and we do plan on publishing it in the near future. So when it does, maybe I can have it posted through Drug Free Sport, some of the things we're finding. I'm sure Laura and her group there would love to have that information to be able to disseminate to you folks who really need it in the field. Now this product here, this company, Olympus Labs, they're based out of New Jersey, but their particular nefarious products that they sell are not sold in the USA. They are sold out of their Predator Nutrition in the UK, but they will still ship to the US, by the way. They just don't market that product to the US audience because I believe somebody has sent them warning letters, and I would believe that's FDA. But this product here, what's the first thing that sticks out to me is the first line, SARM. It's a red flag. It stands for selective androgen receptor modulator. So it's a replacement for testosterone to have the anabolic effect of muscle growth in the body. So we purchased this product from the UK. It took about a week to get here. But the interesting thing is all these products that we purchased them using our company credit cards and have them shipped here to NSF, and apparently haven't caught on to that yet because they continue to take our money, continue to send us a product, and we continue to report on them and report our investigations to the FDA Office of Criminal Investigations. So this is the product we received. Now this one is exactly how it's labeled. It's a little bit difficult to see that, right? It's got some really chemical sounding name. There's a gentleman out of Japan that's doing some work on this, what's called, he's trading it or trademarking it as YK11 and calling it a SARM. Well, let's take a look at the chemical structure here. Chemical structure of that on the left is supposed to be that substance. Well, to me, and with my eye, that looks more like an anabolic steroid. And probably it's somewhere in between. It's probably a partial agonist, partial antagonist of the androgen receptor, so it's not a full-blown agonist, so it has properties of both. Now, the one on the left is a substance called laxogenic. The nominal mass is the same, and this is a kind of steroid that's present in the plant kingdom. So it's not anabolic by nature, but it's present as usually a sapling in the roots of plants. So we tried to test this product, and I was excited to see if it had this substance on the left on it. Tested it. The 357 number is what should be the number that's 430 on the previous page. So as you can see, there are like 4 sharp peaks on there, whereas on the label they only indicate there's one substance in there. So it's really piqued their interest. It's like, well, it's not what's on the label. Let's take a further look and see. We're still to this day have not identified it. I was working this morning with our synthetic chemist, and he has actually isolated it out of the product. We did some additional work, and we're taking it to have NMR done to see if we can't develop a picture of what the actual compound is and what the structure is. So that's hopefully it's some exciting news we'll have, and it's something we can report. And if it's of a danger to risk to human health, we will notify the authorities and get this product off the marketplace. So I'll leave this here to kind of let you think. This is why NSF is in business of testing dietary supplements. Kind of like the acrylamide chips. That's one of my favorites on there. Or colon cancer dogs, yeah. So, I mean, people aren't always honest. Despite the regulations that are there, and they are there, they're pretty comprehensive. But for whatever reason, funding probably mostly, is that it's difficult to enforce these. And my contact information is here. It's also, I believe it's with my bio and things. So feel free to email me at any time with any questions. If you have a label you want me to answer questions about, feel free to send it to me. I do that quite a bit lately, and it's my work, and that's what I love to do. So can answer questions at the end of Brian's presentation, and I'm going to pass this on to Brian. Thank you for your time, folks. Except for...
Nice job, John. I am going to switch over. All right. Thank you, John. I wanted to, at this point in time, see if I can get my, I don't know if you want my mug on here, but there I am. So I want to, at this time, transition from what is in a supplement to how this really affects athletes, how this, also what can be done to prevent this, or to reduce this this risk that John has covered so well. So, let's see. See if I can get to the next slide, possibly.
Hey Brian, this is Laura. You could try, maybe try taking your webcam down and then seeing if that helps.
Okay. Okay. All right. Well, let's do it this way. All right. Sorry about that, guys. So I wanted to cover how does this affect athletes. So to begin, really, as we all know, athletes are always seeking a competitive advantage, which is why dietary supplements are a big part of their routines, part of their lifestyle and their diet. Because of this incessant drive to find a competitive advantage, obviously there are more and more venues that are drug testing. And a lot of this has to do with risk. So this population is a very risk-taking population, as we know. So why do athletes take the risk? A lot of times it has to do with the fact that they don't understand the risks that are involved. They don't really think things through. They don't understand, kind of all the information that John just spoke about and alluded to, all the research that has been done, all those sort of things. So they don't really know it. Now, another side of this that I wanted to discuss today a little bit is there is also the athletes that do have a calculated risk assessment. So they do calculate, the risk to benefit ratio. And what I mean by that is they'll look at supplements, and they'll look for particular supplements that they believe will give them the benefit or the competitive advantage that they're looking for. And I believe we're entering into a day and age possibly that some of the things that the athletes are looking at is based on their knowledge and experience from us, providing information in regards to dietary supplements. So I believe that some of them enter into taking dietary supplements because they believe that they may have banned substances in them, which is kind of crazy. But I think there's a side of that that comes into play, is that rather than knowingly dope or not knowingly, purposely go all in on, taking a steroid or cheating, I think they dabble in potentially taking products that are risky, and they believe that maybe there might be some banned substances in it. And if they get caught, then it doesn't look so bad, right? So it doesn't look like they were trying to cheat. That it looks more like they were, it was inadvertent doping, when really they took the risk knowing that there's probably a banned substance in it, but it was a risk that they're willing to take. And the other side of that is there may be, legal opportunities for them to go after companies if it is an adulterated, supplement. Okay. Okay, the next slide. So going into the drug testing, so you have an athlete that is taking a risky supplement and those sort of things. Well, another side of this is that drug testing programs are becoming more prevalent and stricter. So the problem is there's a vast difference in programs, as all of you, potentially may know firsthand. Some of those are, high schools have little to none to little testing. Colleges, little to some. Obviously there's some differences there in conferences and divisions and things like that. But all in all, it's not until you get to the pro and Olympic level that you really see a comprehensive drug testing. And to shed a little light on that, for those who may not know, Major League Baseball, the NFL, they test for 150 to 170 roughly substances in their programs. WADA's list, obviously, and so are the other two. They cover many more substances that are alluded to in the anti-doping program, but specifically what they've outlined and identified in these anti-doping programs as substances that are banned, there, I mean, it's up to close to 270 something on WADA's list. So the problem, obviously, if you think it through, you know, if you're taking dietary supplements in high school and you're not really drug tested, you go to college and you take dietary supplements that are risky, that are not really tested, it isn't until you get to the higher levels that it could really pose an issue. And at that point in time, we know that you could be set up for failure in a false sense of security. If you've been drug tested and you never fail a drug test, you know, you're not going to be deterred to take a product unless you've been convinced otherwise. So, you know, when you get into 150 to close to 300 substances that they're testing for, this is where I think we start to see some of the inadvertent doping cases. And so this year alone, you know, in last year alone, there was 5 to 10 cases at the professional level that was tied to dietary supplements and unintentional doping. Now, I know the public eye, you know, really looks at it and goes, you know, there's a pretty good chance that these guys were not taking dietary supplements. But in fact, there has been many of these cases proven otherwise. It isn't the case where they're blaming it on a dietary supplement when they're knowingly doping. These cases have been proven to have caused, these dietary supplements have been caused the doping failures. They've tied it to it. So it isn't just the case of the dog ate my homework. It is actual cases that are going on. So we've talked about the doping risks, the drug failing risks for athletes. I wanted to get into a little bit of what are the health risks. So John has, you know, identified a lot of substances that do have, you know, some serious health risks tied to them. You know, the DMAA product and some of the other ones have been highlighted over a period of time, have caused things like liver damage. You know, some other things that we haven't talked about is drug interactions. So I'm sure you guys work with a lot of athletes who may be taking, you know, drugs for health reasons, right? Whether it be, you know, ADHD or other health conditions. If there are substances in these dietary supplements, say amphetamines, what kind of impact does that have on health? You know, the other you know, side of this is the severe side. You know, there are cases of sudden death, like Corey Stringer and Steve Beckler, that was tied to ephedrine and ephedra products in the early 2000s. They died of heat stroke. Now, these are extreme cases, but these are real cases of dietary supplements having a health impact, a negative health impact on athletes. And with my experience being with athletes for, you know, the better part of my career, you know, I experienced firsthand, you know, trying to, you know, help athletes, you know, lead a healthier lifestyle, to make better choices with eating, things like that, and also trying to recover from day in, day out activities. It made me begin to think in this role, what's the recovery and health possibilities hampered by these, you know, adulterants? I never thought of it until some years ago that that truly could have an impact on recovery. What kind of substances could be in these dietary supplements that could be hampering recovery of these athletes, not promoting it, right? And I think the side of this also is many athletes experience and go through a lot of you know, pain, discomfort. It's the, you know, the side effects of you know, years of playing and being athletic in sports. I believe some of these symptoms in athletes may not even be recognized by the athletes themselves because of the things that they, you know, experience day in, day out with stress, physiological stress that they experience for playing the sports. So at this time, I would like to see if Laura will put up the polling question on adverse events reporting, because this ties into what I believe an important part of what we need to start looking at.
Great, thanks, Brian. And while we have people responding, I'll just remind that please use the question bar, and we're going to take questions here in about hopefully 5 to 7 minutes when Brian wraps up. So don't forget to pose those while we've got these guys on the webinar. I'll close this. We got about most everybody's voted. Here are our results. So 86% have not reported an adverse health or know anybody who has.
And I believe that is probably fairly accurate to most of the population, especially the athletic population that we're talking about. That, one, people don't really know what adverse events reporting is or how to do it. And so since 2006, for the people that have reported adverse events, and these are directly tied to drugs and dietary supplements, that it has increased every year since 2006. So it has been required that if companies that manufacture dietary supplements field a adverse report from a consumer or know of any, that they have to report it within 15 days. There's also, on the FDA website, there is a adverse event reporting link that you can report when someone is having an irregular heartbeat, and they give the conditions and stuff. But I think too often this tool is not utilized, and that there's actually things in dietary supplements that people just write off as, oh, I just got flush, or I just have a a higher heartbeat because of the caffeine in it. And there may actually be substances in these, as you've seen with John's presentation, that are not healthy. They're not a natural reaction that you should be getting from these dietary supplements, that should be reported so that it can be investigated. So when you have a large amount of reportings, then usually the FDA investigates to see if there are things in these products that they would need to take a look at. So I'm going to move right along into kind of how we can prevent some of this. So obviously, NSF, we are a independent third-party tester of dietary supplements. There are 3 or 4 other organizations that do provide this service. And I think it's important just to mention that, obviously I'm partial to NSF, but the reality of it is there's an important need for third-party tested and certified dietary supplements, because of what you're seeing with what John presented, and there's a lot of other information out there that reflects of good studies being done on the issues that are at hand. And so, what is what are the steps of third-party testing of dietary supplements? So it begins with us, the GMP. The GMP is a good manufacturing practices and is really the most important part of this process, because it is the entry point of raw materials. It is where the actual finished product is manufactured. So there's a lot of things that can go wrong that can inadvertently make an adulterated product, or it can also there's things that can be done in that process that causes issues, or lack of cleaning makes for a tainted product and things like that. So the first thing we do is we go into when a company comes to us, we go and do an on-site audit. So there's ways of doing an audit. We do a physical on-site audit that we can go through, and not only the paperwork, but we go through the testing of the facilities for all the things that the swabbing to the SOPs to how they clean to everything. So we do an on-site audit. The next part of that, once they've corrected their issues and are a registered manufacturing facility, then a product is sent in for testing of the label claims. So we look at the label claims, see what ingredients are on there, what they're claiming those ingredients to do, and so that's our review of a label claim review. That's done by our toxicologists. Once that is completed and there are no issues, then it moves on to the next step where a product is tested for the banned substances. So we are north of 265 banned substances that we are testing for in dietary supplements. And we are also testing not just for banned substances, we're testing for heavy metals, pesticides, and contaminants that may be in dietary supplements, obviously from a health and safety standpoint. On top of that, we are looking at ingredients as well, and the claims of how much is in the products and what those ingredients are actually, if they're actually in the product that is part of our testing. The last part of it is our certification and listing of products on our website and our app, and also the mark is approved to be used on products. I'll try to move right along. Now, why do brands manufacturers get product certified? A lot of it has to do with quality assurance and risk management. They do that mainly for general consumers, so that if there's not needed recalls, there's not health issues that can be come back on them. Mostly for the Certified Sport Program and athletes, it is they come to us to get certified, so that one, they're reducing their risk for athletes, and two, being able to get in the hands of athletes, because most leagues and teams will not allow their athletes, or will not purchase supplements for their athletes that are not have not been third-party tested and certified. Why don't more brands and manufacturers get products certified? A lot of it has to do with cost. The cost of entering into the program, their margin flexibility. If there's ingredients that are they can find cheaper and they can kind of maneuver around with their formulas, that allows them the greater margin flexibility. If they enter into, say, a third-party certified program, they don't have that flexibility. They have to have and claim what's on the label to be inside, and nothing that isn't. And so, and there are some bad players in the industry that, as John showed, play that game. There are some good ones that do want to get third-party certified and tested and want to provide a good product to the industry and consumers. And I'll wrap up real quick with this. The role that you play is to educate the risks and rewards. Listen to the wants and needs of athletes with dietary supplements. Saying no and that food will cover everything is ideal. It is what everybody should be shooting for. But for most athletes, it's unrealistic with the demands of travel, the demands of game schedules, and the cost of real food. Provide information resources to make better decisions. Athletes do at times make good decisions if are provided enough resources and enough information to make these decisions. And then most of you, I know I'm assuming this, but been in the industry a long time, that most of you are the gatekeepers, and companies are looking for access to the athletes. They're looking to access to you guys. I would say don't be influenced. Stick to your gun to what you believe in, what is healthy, and what you know to be less risk for your athletes. Lead by example. There's been plenty of people that say do as I say, not as I do. That they will say take third-party tested, certified supplements, and they themselves do not follow suit. So it is very important to lead by example, especially with adolescents, I believe. And only provide and recommend third-party certified products. I mean, it is that simple, and there's plenty of choices out there to be able to do that. And so that is something that you can do to reduce risk and issues health-wise. These are resources that I find very useful, and I hope you do as well. But USADA's 411 is a great resource to find products that have been identified as having banned substances. Operation Supplement Safeties along the same line from the government standpoint, and then the FDA has buku information, has lots of information. It's a little difficult and dry, as John had mentioned, but it does have a lot of good information to find out about dietary supplements. And that is it. Sorry I ran over, Laura.
Oh, it's no problem. I'm going to, while we wait for some questions to kind of start rolling in here, I would like to, I'm gonna show my face again here so we can get all our speakers up there. I just want to take a moment while we have some questions coming in to just make sure that people know other education programs and services that we offer here at Drug Free Sports. I'm going to cycle through these without just kind of going through them specifically, but we also have another webinar coming up. So if you enjoyed today's or have seen any of our other recordings that have been on our website, we've got an excellent presentation coming up for on race and diversity in sport, and we have 3 players from the University of Missouri-Columbia who will be coming to speak with us, and you can see those learning objectives. And I tried to make the attendee link very small so you can maybe copy that while you're taking a look at this slide. But let's take some questions here. I would say one of the interesting ones that came up for you, John, when you were speaking was I think somebody saw that on one of the product labels it listed the ingredient Nupept, and they're wondering about what you know about these types of products that are labeled as nootropics, and often in these kind of brain boosting supplements that we might be seeing a lot for athletes.
Right, that's something that's very new, and stay tuned for that. I'm working with one of my collaborators on the Nupept itself. We're doing some work, so I don't want to jump the boat on that. If whoever it is wants to send me a personal email, and once the publication comes, I'll send them a personal copy so they can read it and have all the information that they need.
Great. Okay, the next question comes from Amber, and she's looking for some clarification. If either of you can touch or weigh in on this, but some products that are marketed as dietary supplements, even some protein powders, are often labeled with a nutrition facts label instead of a supplement facts label. And so she's just wondering how the regulatory requirements differ in these products, if you guys have any expertise to share.
I'll take it. So when it comes to protein and it comes to these kind of products, they have, based off claims, the ability to either use a nutrition facts panel or a supplement facts panel. Now, it's really, I hate to say it's that simple, but it is that simple. If they're claiming to promote, muscle strength and things like that, then they can go the route of a dietary supplement. But with protein and those things, they can have the choice of, depending on how they market and their claims are, they can be either a nutritional facts panel or a supplement facts panel. Great.
Next question, or I guess a comment that came in related to that from Oliver. Nupept may not be a legal supplement ingredient, and so that might be where some of John's work may be coming in, but maybe some question about whether or not that should actually be an ingredient on the marketplace. So I think that's something too for us all to pay attention to for these ingredients, whether or not they are actually safe or not. We have a question from Nikki, and her question is, do high school athletes need protein every day? And so I assume that might be one for Brian, if you have any comment there. And I assume that's related to, do they need a protein supplement every day?
I have been and will always be a food first person. I believe that if said person or anyone can get their ingredients, their nutrients from foods, that it should be that first choice. Now, there are, in high school, I would say probably wouldn't be a need as much as, say, a collegiate and professional athlete who is further along in their physical development, and then also the demands of games. Granted, high school kids now are playing a lot more games, but being able to sleep is probably the most important thing that you can do for your kids and for high school athletes. The professionals and the ones that are traveling more and playing 100 and some odd games, things like that, yeah, there may be no possible way to get in the amount of nutrients that you need without some kind of supplementation.
Great. Well, that takes us to our time. I know there's a number of other questions that have come in. I do encourage you, if your question was not answered, do reach out to our speakers. I'm sure they'd be happy to answer that. You can also direct it to me here at Drug Free Sport, Laura Gray, lgray@drugfreesport.com. And thank you for joining us for today's webinar. There will be a brief survey at the close, so please take some time to share your feedback with us as we continue to improve our topics that we deliver, and appreciate that very much. So on behalf of Drug Free Sport and our speakers, thank you for being here, and everybody have a terrific day.
Thanks, guys.
Thank you, folks, for attending.